The 17th Annual Competition Law, Economics and Policy Conference drew to a close today. Let's bring in Hardin Ratshisusu, the Deputy Commissioner of the Competition Commission, for more on this. Thank you so much for speaking to us this evening, Hardin. An array of topics were discussed over the past 2 days, from food pricing to the African Continental Free Trade Area. What stood out from you during your engagements?
The highlight of this conference was and amongst other discussions, but I think the speech by the Minister of Trade, Industry and Competition, Minister Patel, highlighted areas. In fact, he looked at the past 5 years of competition regulation in South Africa and identified 8 areas that we have made significant strides on as competition regulators. So these are issues around greater policy coherence. You can see in the manner that we enforce the law in South Africa, implementation of the legislative reforms from 2019, the role of competition policy in promoting inclusive growth, addressing high levels of concentration, and flexible and rapid response. You saw that during COVID, what the competition authorities were doing, focusing on new growth sector, the online digital inquiries that you see that we just concluded, price monitoring. So we do regular food price monitoring, and this is promoting transparency in markets. And lastly, the African Continental Free Trade Area Competition Policy Protocol. This, as you are aware, has been adopted by the heads of states of the African Union, and it is a protocol that will, in time, be implemented and allow African countries to tackle cross-border anti-competitive practices and those significant measures that we are not able to effectively tackle individually as authorities.
So your goal is to foster an inclusive, growing and deconcentrated economy. How far are you from achieving that goal?
This is a very bold and ambitious task because, as you know, and we did studies before, which shows that a number of sectors in South Africa are quite highly concentrated. I can give you just one example on the things that we have done recently. We, in the retail sector, as you know, following our market inquiry, we found that there were exclusive leases in shopping malls. What happened with our intervention, you are not going to find those exclusivities anymore. We have had commitments from major retailers to remove exclusivity. What that does is that you are going to find new players in shopping centers. You are likely to find new bakeries there, butcheries, fresh produce players, and that will be at a national level. That's just one example. And through major control, this is where we talk more of inclusive growth. You will see that we are now advancing interventions that address public interest, particularly the participation of small businesses and those historically owned by historically disadvantaged individuals in the markets. So there are very meaningful and clear interventions that we can show.
So the NHI is also under discussion. Where will the Competition Commission be putting their focus in this regard?
This was a very robust discussion at this conference. In fact, it's one of the few where we spent a bit of time on. So we had a panel, from the Board of Healthcare Funders, the Department of Health, practitioners. What is clear, though, is that there is a need for competition regulation, particularly on the suppliers of products or services that would be supplying those to the fund. You don't want a situation where companies that deal with the fund in future are not subjected to competition regulation. And all panelists agree that there is a role to this because you can see that currently, even pre-NHI, we are investigating a lot of excessive pricing cases in pharmaceuticals. I think we have a case before the tribunal on breast cancer. We just launched an investigation on TB drugs. So there is a role for competition authorities.
Thank you so much for speaking to us. We really do appreciate it. That was Hardin Ratshisusu, the Deputy Commissioner of the Competition Commission.